This is SiriusXM Doctor Radio.
And now, from the heart of the NYU Langone Medical Center, this is Doctor Radio Reports. Coronavirus. What you need to know now. Here is your host, Dr. Marc Siegel.
Welcome back to Coronavirus COVID-19, what you need to know right now. I'm Dr. Marc Siegel. I'm the medical director of Doctor Radio. I'm a professor of medicine at NYU Langone Health. I'm a author of books on pandemics and public reactions to pandemics, and we've been studying very, very closely this pandemic, coronavirus COVID-19, the virus SARS-CoV-2, and we've been talking about it, and we're watching it. Overall, the number of cases in the United States has started to go down. Certainly in our hotspot here in New York City, where we're broadcasting from, we've seen less hospitalizations, less cases, thank God, less deaths starting to occur. Around the country, we're seeing some signs of reopening. Of course, during the current ongoing protests around the country, there is some concern. I am somewhat concerned about the lack of social distancing. Of course, when people are afraid, when they're angry, when they're passionate about something, they tend to take fewer precautions. It's hard to instill social distancing into a crowd of people that are protesting. That's unfortunate, and it's always been that way. It's always going to be that way. The question is whether it's going to lead to more COVID-19 cases. We will see. In a weird way, and I mean this purely from a public health point of view, if a week from now we don't see a blip in cases in these cities where the protests are going on, then maybe that's a sign that we're starting to peak or starting to really flatten out or decrease as the summer months come. This being a respiratory virus, there is some possibility or probability that it has a seasonal component. We're starting to see big upsurge in South America right now, which is entering their late fall. If you want to talk to us about COVID-19, where we are, coronavirus, give us a call at 1-877-698-3627. That's 1-877-698-3627, or email us at docs@SiriusXM.com. I am really a great pleasure for me to be joined in this half hour by Samantha Heller, who is a registered dietitian and author of several books, including The Only Cleanse, a 14-day natural detox plan to jumpstart a lifetime of health. She's a senior clinical nutritionist at NYU Langone Sports Performance Center. She's the host of the Health and Nutrition Show on Doctor Radio, Fridays at 12 noon Eastern Time. That show is on hiatus, but it's going to be coming about soon, and you're about to find out why, because we have a question for you, Sam. By the way, Sam, you should know they listed you as an MD. That may be a slip, or it may be something to do with what an expert you are and how smart you are. If I were giving out medical degrees, I would give you one for nutrition. Welcome to the show.
Well, you are too kind. There actually is an MD at NYU with my very same name.
Oh, there is?
Yeah, she's a radiologist, so people do get confused. I get her emails often.
Well, the way things are going, she may call you in a week and say, how about reading a few films for me? I need a break.
Yeah.
If you have questions about nutrition and about whether nutrition impacts your susceptibility to COVID-19, your recovery from COVID-19, something that you should be doing while this pandemic is going on, or something I'm really fascinated to ask one of my favorite guests and hosts in the world, is there something nutritionally you can take to either prevent or treat COVID-19? I'm going to put you on the hot seat right away, Sam. What about zinc?
I knew you wanted to talk about zinc. You know, zinc is an essential mineral. We only need a tiny amount of it, but it's really important. It's a part of our immune system. It's a part of wound healing. It's important in brain health. Now, the average intake for an adult, we need somewhere around 11 milligrams for men and maybe about 8 milligrams for women. So that's not a lot. What the research is looking at is zinc lozenges in terms of helping decrease the duration of certain upper respiratory illnesses. And these are zinc lozenges you can get in, over the counter anywhere. They have seen some evidence to suggest that when you suck on these zinc lozenges, the zinc works locally in the nasopharynx area and in that tissue to help decrease the risk of some of these upper respiratory viruses from moving in. We do not have enough data to say that it will prevent or affect COVID-19. In addition, if you take too much zinc, you can have side effects like nausea, vomiting, taste changes. The zinc nasal sprays were very popular for a while, but there have been reports, and the FDA suggests not using them because they can cause permanent smell problems, like losing your sense of smell, which of course then affects your sense of taste. So if you feel the signs and symptoms of an upper respiratory infection, you can suck on some zinc lozenges. The dose of zinc in a lozenge varies depending on the company, so you want to look at the package and follow their instructions, but you don't want to do more than 30 or 40 milligrams a day. The upper tolerable limit is about 40. So if each zinc lozenge has 10 milligrams, you don't want to do more than 3 or 4 of those in a day, spread out throughout the day. However, you can get zinc from food like cashews and chickpeas. It's a high concentration in oysters, and please don't eat them raw. If you're going to have oysters, make sure that they're cooked. So zinc, interesting. We need it for our bodies. You can also get it in over-the-counter cereals that are fortified with 100% of the RDA of a lot of our vitamins and minerals. So most of us do well with zinc. A zinc lozenge at the onset of symptoms may be helpful.
And I buried the headline here, Sam. We have a study ongoing at NYU. Preliminary results seem to show that the combination of zinc pills plus hydroxychloroquine, although that could be some other ionizing agent. What happens to be what they study, which is helping get zinc into the cells. It's not the same issue of what we're studying it for separately. But there's a study ongoing at NYU that seems to show that zinc pills, taking zinc actually decreases the duration of symptoms for COVID-19. That study is ongoing, but preliminary results look like it may play a role here. That's different than what you're saying.
They're doing studies on zinc and vitamin C as well for upper respiratory illnesses and certainly for COVID, but they're so early, it's still really new. And let's talk a little bit about vitamin C. You know, years and years ago, Linus Pauling thought vitamin C was such an awesome vitamin, which it is, but he really encouraged people to megadose. That did not turn out to be the silver bullet of decreasing colds and boosting your immunity, because too much, as you know, Mark, too much of a good thing is way too much. And really, we don't need that much vitamin C in our day, like about 75 milligrams a day for women, maybe 90 for men. And it's very prevalent in foods. It's in red peppers and oranges and limes and lemons and strawberries and kiwi and Brussels sprouts and broccoli and orange juice if you have a little bit of orange juice. However, a little extra vitamin C around this time, if you're not eating healthfully, which I've heard from a lot of people and my patients that they're having a little difficulty managing some healthy eating, maybe 500 milligrams a day would be fine. I just don't want to overdo it, because too much vitamin C can cause some GI distress, but it also knocks off the very delicate balance of other vitamins and minerals in our body, like selenium and vitamin E.
This is extremely important, by the way, and this ties together with the zinc issue, too, because zinc has got some properties of being an antiviral. That's what we're talking about here. Vitamin C, that Linus Pauling put that forth, but his large studies weren't properly randomized, didn't have proper control group at all. That's one of the things that we've brought forward. And Sam just said something very sensible, and I think she was couching it against what she knows and I know, which is that there's people using intravenous vitamin C as a treatment for COVID-19. But I think we need to caution people that there are question marks, but none of these things are proven. And there's really, it's such a time of anecdotal stories and people saying, does this work, does that work? I don't want people, Samantha is very well balanced. We don't want people to be jumping to some completely unproven treatment at a high dose. And she just pointed out vitamin C can actually cause harm if you take too much of it. Sam, what about vitamin D?
You know, the studies on vitamin D are interesting. I don't think they're telling us anything we don't know. In general, many of us are insufficient or deficient in vitamin D. We mostly get it from the sun. If you live in northern latitudes, the sun isn't strong enough to generate vitamin D in our skin between October and March. It's not found in a great abundance in food, in some fish and fortified foods like milk and certain juices, but most of us are just not getting enough. Now, what they have found historically, and again now with COVID, is people who have low levels of vitamin D, either insufficient or fully deficient, and that's just a matter of numbers, are at greater risk of getting the disease, or also at greater risk of having other diseases like cardiovascular disease, diabetes, multiple sclerosis. So vitamin D is something, and I'm curious to know what you think, Mark. I generally recommend, again, with your doctor's permission, we don't want any interactions with other medications you're on, a supplement. I think taking, 1,500 to 2,000 IUs, international units a day, is perfectly fine. You don't want a megadose because vitamin D is a fat-soluble vitamin, which means it can sort of build up in your tissues, so you don't want to take megadoses unless your doctor says you need to, like if you have to replete a deficiency. But I take I take a vitamin D daily because I was fully deficient a few years ago, and I'm outside running without sunscreen. Now, you want to wear sunscreen, but it does decrease about 95 to 99% of the vitamin D that forms in our skin. People of color produce less vitamin D. So I think in general, a vitamin D supplement is not a bad idea. Again, nothing replaces a balanced, more plant-based diet. Nothing replaces getting enough sleep and enough exercise. Nothing replaces those vegetables and fruits and legumes and whole grains and nuts and seeds that we want people to eat, because all of the compounds in these foods work synergistically to keep our very complicated immune system healthy. As you know, our immune system is involved in our GI tract, our spleen, our lymph tissues, our bone marrow, our tonsils. It's located throughout our body. So overall healthy balance is what is going to help us stay strong and reduce the risk of infection from any kind of illness.
Samantha,
and you know what I'm hearing a lot about is people stress eating. It's people are at home. They're going out a little more nowadays. It's certainly in the Northeast or northern, parts of the country. The weather's getting nicer to go out. Hopefully you're all wearing masks. Please say you are. We're washing our hands. We're being careful. But people are home a lot more than usual, and they are spending a lot of time walking back and forth to the kitchen, opening the cupboards, opening the refrigerator, looking around, wanting to eat. And people are making jokes about the COVID-19, meaning like the freshman 15 pounds you gain when you go to college, the COVID-19, the pounds people are gaining when they're sitting at home. So there's some strategies to help manage stress eating, and I think I've gotten a lot of contacts from my listeners on my show on Doctor Radio, and if any of you are listening now, I miss you and I love you, and I can't wait to come back and talk to you more. But stress eating is a big issue, and I think that there are ways we can handle it, and there are ways to manage it, and we can talk about that if you want.
By the way, I want to get into that more and more, and I want to point out that we're going to on Friday later this week, we're going to have a guest who studied the socioeconomically disadvantaged population that ended up being admitted to the hospital in Louisiana. And she found out that 70% of the hospital admissions are among black people. And the reason is partly because of work exposure being different, partly because of diet being different, partly because of pre-existing conditions being different. And one thing we have to emphasize with Samantha, of course, is the issue of obesity and how it has clearly turned out to be a major risk factor for complications of COVID-19, because we believe and have almost proven at this point that COVID-19, when in its severe stages, causes an inflammatory process, and those inflammatory chemicals are often those that are found in obesity. So it looks like the inflammation of obesity, that people don't always realize that obesity is associated with inflammatory chemicals, but Sam is always talking about that, and we're seeing the same things with COVID-19. You want to talk about that connection, Sam?
Well, it's interesting when you talk about people who are overweight or obese, we think that they're hypernourished, and in fact, many of them are undernourished. meaning they're not getting all of the balance of vitamins and minerals and healthy plant chemicals that we call phytochemicals, and the balance of the fats and the carbohydrate and the protein that we need to be healthy. Part of that is due to obesity. The body fat cells like to store those fat-soluble vitamins like vitamin D. A lot of people that are overweight or obese are low or deficient in vitamin D, and that causes that sequelae of issues that we discussed earlier. If we're eating a lot of unhealthy foods, then we're affecting our gastrointestinal tract, and 80 to 90% of our immunity lives in our GI tract. So if you're eating a lot of fried foods and frozen pizzas and buckets of chicken and chips and cookies and sweets, or drinking too much alcohol and self-medicating with food, which I think a lot of people are doing nowadays, it's a very challenging time. Our GI tract and the creatures that live there, that microbiome, those millions of bacteria that live there that help keep us healthy, they have to eat what we eat. They're not going to be happy. The food they love comes from the fiber we eat in plants. So whether it's broccoli or Brussels sprouts or whole wheat or lentils or chickpeas or hummus, any of these foods, apples and oranges and fruits, these help feed our gut. They keep our gut healthy, and when our gut is healthy and the creatures that live in our gut are healthy, the rest of our body is going to be healthier. So when we shift to those healthy plant foods in our diet, and we're more balanced, and we stay away from the junk. Don't buy it. Don't bring it home. Don't have it in the house when it's calling to you from the kitchen. You're in your living room, and you can hear that voice of those chocolate chip cooks saying, "Eat me," and the ice cream saying, "I'm melting, eat me." So we need to not have it around if we're going to be in the house a lot more than usual. And that's going to help us manage our weight, which is also going to help improve our immune system.
To which I have an email from Justin, right on point. What is known about connections between insulin resistance and related metabolic disorders and COVID? Any insight into the mechanism? Is this a good time to reconsider our nutritional guidelines that seem to have encouraged a massive increase in metabolic disease, specifically low fat? Well, I mean, our guest is not going to agree with low fat being a bad thing, right? I mean, unsaturated fats are good.
I think unsaturated fats are fabulous. I'm not a huge fan of the very, very low-fat approach that some health professionals with whom I have great respect suggest. I think we need, as you know, we need fat in our diet. We need it to absorb vitamins. We need it for energy. We need it for enzymes. We need it to protect our organs. And it tastes good. We want food to taste good. Food should be pleasurable. But we want those plants that are those fats that are liquid at room temperature. So the fats, just think, what's liquid at room temperature? Olive oil, avocado oil, canola oil, sunflower oil. These are the oils we want to be using more when we're cooking and when we're making foods, compared with the ones that are solid at room temperature, like butter and cheese and coconut oil, palm oil. Those are the ones we want to consume much less of.
Let's go to Howard briefly on line one. Howard, you have a question about zinc. What's your question for? We know you very well, Howard. Welcome back from Syracuse. What's your question for our star here?
I'm 87. When I was 60, my ejection fraction was 40. It's now 66, and that's without a bit of exercise. So I'm into supplements big time. But zinc, if you take around 40 or 50 milligrams of zinc a day, you should take at least 2 or 3 milligrams of copper, because the zinc knocks the copper right out of your system.
Okay, thanks for that, Howard.
The balance of zinc and copper is a very delicate one, and you're right, Howard. If you take too much zinc, it does knock your copper balance off. But 40 milligrams of zinc is probably a little high for most people, and it's in fact the upper tolerable limit in terms of toxicity and having those unpleasant side effects. So maybe your body's used to that right now, but it's not a level of supplementation that I would recommend.
Sam, could you comment on the overall question here, which I know you can't answer, but I want to hear your answer anyway, which is this. People probably understand that there are viruses everywhere and that we encounter them all day. In fact, any listener out there, especially in a hotspot area, could have encountered COVID-19, maybe some particles of it. So they somehow touched it. It's not like one viral particle is going to give you COVID-19. It's a certain number, and we don't know what that number is, but the number is not one. It's somewhere in the hundreds, probably. I mean, they're going to have to eventually give us that answer. It's certainly very transmissible. But Samantha, if you exercise regularly and you sleep right and you're under less stress and you eat right, which again, I sometimes listen to your show just to hear how to eat right. And my kids, when they were younger, would listen to you and say, "Hey, that's not Doctor Radio, that's nutrition." In other words, it's like so universal, the information you have. What's your prescription for warding off COVID-19, if there is such a thing? Again, I'm going to throw the caveat in, if there is such a thing as warding it off.
It's what I said generally. We have to live a balanced life, and as we sit home, as we stay home, maybe we're feeling sad or angry or depressed, and that makes us curl up and not want to move. So my pitch for exercise is, and the kind that you get a little hot and sweaty, your heart rate gets up, you're outside, you're moving, or inside dancing around the house, running up and down stairs, that exercises our lungs. That actually helps keep our lungs healthy and inflated and working. And that will also help keep our lungs immunity stronger. We have to stay well hydrated. When we're not well hydrated, and alcohol doesn't count, folks. I'm so sorry to tell you that, but it doesn't. But when we're hydrated, tea, even coffee counts, water, seltzer, diluted juice, or a splash of juice and seltzer, that helps keep our mucous membranes healthy. And our mucous membranes are a big form of defense in our immunity. We need to keep our skin healthy. Put moisturizer on it. Keep your sunscreen on. Our skin is the first barrier against anything in the outside world. It's like a super suit. We don't even think about it. And again, we want to make sure we're not overeating or undereating. Stress affects different people differently. When I'm really stressed, I don't eat. When some people are really stressed, they eat a lot. So it just depends on what's happening in your life and your body. Plan your snacks. Be thoughtful about your meals. Don't keep running back to the refrigerator when you're watching the news or something's upsetting you or you're angry or you're bored, because, yes, it is a great distraction for that moment, for that second, but it doesn't last. So this is when you get up and run up and down stairs, do some push-ups, find some alternative ways to manage that stress, to get that stress moving, burn those stress chemicals out of your body. Even being creative, crafting, writing, singing, listening to music, drawing, painting, woodworking, sewing, anything you can think of to do or learn how to do, watching documentaries, learn a new language, get that brain exercised, exercise those neurons in your brain. This all helps contribute to a healthy overall body. When you're healthy overall on all of those levels, your immune system will be more robust. We don't have the perfect solution for who will or will not get sick, who will or will not get this upper respiratory infection, and I think that's the huge challenge that we're all facing. But the healthier we are, and now's a great time. People say, "Oh, I don't have time to cook, I don't have time to exercise," and you know what? Now you do. Now you can learn how to cook some of those recipes you haven't cooked. I ran into a woman at the vegetable store, and I was loading up on vegetables. I'm carrying like 30 pounds of groceries, 20 blocks in the city to save money, and so I don't have to go to the store a lot. And she's like, I've been a vegetarian for 30 years, but I don't cook, and I'm just having to figure out how to learn how to cook. And I said, well, now's a great time to do that. So I gave her some ideas.
Sam, in that regard, and by the way, I want to add to one point you made, which is the idea of a barrier against COVID-19. I think keeping your mucous membranes, your nasal passages moist is a good idea, because most of the time viruses get in through the nose, and there was a previous emailer we didn't get to. They can get in through the eyes as well. Yeah. Through mucous membranes. So keeping everything moist and moisturized, and keeping your nose and nasal hairs moisturized, that's something that Samantha's been talking about. Sam, I'm going to ask you a question no one's asking you, right, I bet, which is, at this time of hunkering down, can you give advice to people out there about what to avoid in the supermarket? In other words, are people getting sick because they don't go shop, because food isn't as fresh, or they don't get out as much, or they're afraid to go to the market? I mean, are we seeing a risk of food that we didn't see before?
I think there's a lot of fear and food insecurity. I think older people and people who are immunocompromised are fearful of going out, and they may not be able to afford to have food delivered and pay those delivery fees. So that is concerning because we certainly don't want people to be undernourished. If you know of older people in your apartment building, in your neighborhood, and you can do some grocery shopping for them, that will be helpful. I don't know that we have data showing that, people of a certain age or certain illnesses are suffering right now, but it would not be surprising if that were the case. There's people in my building in the city that, we're bringing food to and we do some grocery shopping for because they're scared to go out. But on the other hand, they're also fearful of movement, so that when you're sitting more, we talk about sitting being the new smoking. When you're sedentary a lot, that decreases circulation, that decreases energy, you lose muscle mass. So it's sort of this cyclic, this downhill cycle that we don't want people to get in. So there is some food insecurity. Some people are not getting enough food right now. Some people can't afford it. Some people are out of work. Donating money to food banks is a great idea because the food banks know what they need and they can buy the food. But you can also bring food as well.
Very quickly, I want to go to another caller before we break. Laura from Chicago, what's your question?
Good afternoon. I was diagnosed with COVID on May 5th. And I was in quarantine until May 18th, doing fine. But my question is, obviously I have antibodies built up, I assume. And can I give COVID to somebody else now, or no, that's my question.
Okay, Laura,
that's such a good question, Mark, and I wanted to ask you that too. If you have antibodies, are you likely to be a carrier?
So here's the answer to that. We need more study on the kind of antibodies we're making. There's too many different tests out there. But if you have what's called neutralizing antibody, if your antibodies signify that you've developed an immunity, which is actually very likely, and because they just studied the other kind of immune cells, T cells, which are very important in fighting viruses, and it looks like people that make the antibodies also are making T cell immunities. So the answer to the question is very likely you have some degree of immunity, and no, by the time you develop that antibody, IgG we're talking about, you are not transmitting it to someone else. I can't say that with 100% certainty, but very close to that. It's a sign you're over it. It's a sign that you've recovered. The chances are very high, especially if you're not symptomatic, by the way, that you're not going to be. I can't say anything with 100%, but the answer would be no, you're not going to be transmitting it. Thanks for the call. Samantha, I want to thank you for joining us for this half hour. I'd love to have you back as this evolves, and obviously I'll join your show whenever you have me. And when it's back,
I want you on my show.
Samantha Heller is our resident nutritionist here. She's a registered dietitian, author of several books, including The Only Cleanse, a 14-day natural detox plan to jumpstart a lifetime of health, senior clinical nutritionist at NYU Langone Sports Performance Center, and host of the Health and Nutrition Show on Dr. Radio Fridays at noon East, returning to air soon. Thanks very much, Sam, for coming on.
Thank you, sweetie. You have a great day. Thanks, everybody.
You too. When we come back, we'll be joined by the Deputy Director of the Centers for Disease Control in charge of infectious diseases. Let's hear what he has to say. We'll be right back.
Never miss a beat of Doctor Radio with the new SiriusXM app.
Doctor Radio.
Streaming now included with most SiriusXM subscriptions.
Go to SiriusXM.com/more.